Do you feel as if your jaw is too wide? Well, this is something that does affect a lot of people, and I find that it affects more in Asians, but a lot of Caucasians are coming in for this same issue. So, what causes a wide jawline? Well, technically, one big cause of a wide jaw that is very treatable is excessive growth of the masseter muscle. The masseter muscle is a muscle of mastication, meaning it's a muscle that helps us to chew and to grind our teeth. And that muscle here is right along the jawline here. And you can feel it because when you clench your teeth nice and tight, it feels like this firm muscle right along the side. So if you can feel that, and if you look straight ahead at yourself and clench your teeth and you see that really stick out, then you know that that may be contributing to the width of your jaw. So there are a lot of Asians and even a lot of Caucasians who present saying, look, I feel like this part of my face is too wide. And if that's you and you feel like this part of your face is too wide, then actually reducing the size of that masseter muscle, which is right in this area, can help to thin that part of the face out. So what causes that masseter muscle to get overgrown? Well, the first thing is it could be if you grind your teeth. Okay, if you grind your teeth at night, and you may do this and not even know it, then that muscle may be continually working itself at night. You may be basically exercising that muscle, causing it to get thicker and larger. Second thing is if you chew a lot of gum, same idea, is that you're using that muscle a lot by chewing gum, and that can cause that muscle to get bigger. So if you decrease the grinding and you stop chewing gum, then that may be a natural way to get that muscle smaller. Other people, it's just genetic. We see that in a lot of Asian people, and that's why I started doing this procedure to treat it. When I first started my practice, upwards of 14 years ago, we would inject, I knew I was going to see a lot of Asian people, so I thought, hey, let me get a good way to treat that because this was a concern that a lot of Asian people have. It's as a genetic thing. Now that I've been in practice for so long, I do see a lot of Caucasian people with the same concern. So how do you then treat the excessive growth of the masseter muscle? Well, back a couple of decades ago, the only option was surgical. And typically plastic surgeons out in Asia, like in Korea and even Japan, they would go in and actually cut that muscle out. And it was a very aggressive, a bloody operation with a high complication rate. That's why I've never done the surgery, and it was never really popular here in the United States. And so what we do have, though, is a great option now that we didn't have way back then, and that's Botox. So Botox is a great way to narrow a wide jaw. Okay, so once again, when the wide jaw is due to excessive thickness or hypertrophy of that masseter muscle, I can inject Botox typically into that belly of that muscle, cause that muscle to get weaker, to get paralyzed, and then it atrophies or it gets smaller. The way I describe this is similar to when somebody breaks their leg and they have a cast on that leg. For several months, they don't walk on the leg very much, they don't use it, and when the cast comes off, the leg that had the cast on it is much smaller than the other leg that's been being used. And so the more you use a muscle, we know this, the bigger that muscle can get. And if you don't use the muscle will shrink down in size. So by injecting enough Botox into the masseter muscles here, we can cause that muscle not to work and to gradually atrophy or get smaller. Now, because of this, it's not like when you inject Botox, let's say, into your glabella or into your crow's feet, where a week later you see the results and you go, wow, this is great. When you're injecting Botox into the masseter muscle, it can take a month or so to really start seeing the results. Okay, and in those people who have a really thick masseter muscle, sometimes it takes a couple of treatments to gradually shrink that muscle down to the point where it's really small. Now, when the muscle's fairly big starting out, I do recommend starting out with a hefty number of Botox units, and that's anywhere from 30 to 35 units per side. Now, when I started my practice years ago, I started with much smaller amounts, 15 to 20 units, and we had a lot of patients that were non-responders. It just wasn't enough units to really work. Now we're hitting them with anywhere from 30 to 35 units to start out with, and we're having a much, much better success rate. Okay. Once again, it will take a few treatments potentially to get that muscle all the way down as that muscle shrinks down in size the more that you inject it. We do recommend retreating this area every 6 months or so. Unlike regular Botox that you treat maybe every 3 to 4 months before it wears off, you can really do this every 6 potentially because it does take time for that muscle to come back. So if you want to save a little money and do it every 6 months, that's reasonable. If you want to do it every 4 months, that's probably better. And then, like I said, it does take time, but it does work. The hope is that as that muscle shrinks down in size and you're getting a better contour and you're happy with it, because the muscle's a lot smaller, we don't have to use as much Botox. And you can go from, let's say, 35 units your first time to hopefully 25 units the second time, and then maybe even downsize up to 15 to 20 units as kind of a maintenance type of a dose. But that is different with every patient and something that we can talk about in the actual face-to-face consultation. Now the treatment is very, very simple. Okay, I do the Botox injections for this, as do my specialty injectors in my office. Typically, we can use either a little spray to numb the skin up, or sometimes we don't really need anything. It's anywhere from 3 to 6 tiny injections into the belly of that muscle. Put a little pressure on it, and that's it. You can do whatever you want afterwards. You can eat food. You can, exercise, whatever. Very simple procedure to have done. There are risks with it, but the risks are tiny. With Botox, the good thing is if you don't like it, it wears off. The bad thing about Botox is if you do like it, it still wears off. So there is a risk of a little bruise there. There's a risk of a small hematoma, a little blood collection, although extremely rare for that. There's a risk that maybe you won't see the results you're looking for. Okay, there's a risk that it will necessitate a few treatments to really get it down. So definitely be patient, but this really does work. So if you've got a wide jaw, I think this is a very good option for you. Just to let you know that it really treats just that muscle. Okay, so if you've got jowling, this won't do it for you. If you've got chubby cheeks, then take a peek at the section for chubby cheeks where I talk about a buccal fat removal, which will treat this area. That's the area right in front of that masseter muscle back here. Okay, so that would be separate. And sometimes we'll combine the Botox out here to thin this part with a buccal fat removal to thin right in front of it to get a nice thinning effect of the lower face. And those people will have more of a bottom heavy or a chubbier face that they want to reduce in size. So I hope this was helpful for you. If you've got a wide jawline, we've got a great option for you. It's minimally invasive. The injections take 5 minutes, probably 5-10 minutes total. And it really does work. Got to be a little patient with it, but it does work. And if you stick with it and do it up to, like I said, twice a year or so, then hopefully we can really downsize the amount of units that are needed and just keep it up as a maintenance. Thank you for watching.